So I'm going to be talking about the auditory processing disorder. What is it exactly? It is known as the central auditory processing disorder, but throughout this presentation, I will refer to it as APD. So it is a disorder of the hearing or auditory systems that causes a disruption so that an individual's brain can't fully understand what it is that they are hearing. Audiologists can diagnose it though after conducting tests, and these tests measure specific auditory processing functions. This is a hearing disorder, but it is important to remember that having APD is not a form of hearing loss. The symptoms of APD overlap with other diagnoses such as ADHD and learning disorders. Those who have APD do often tend to also have one of these diagnoses as well. So when the vibrations reach the inner ear, there are various sensory cells that create an electrical signal. This signal then travels through the auditory nerve to the brain. When it's in the brain, the signal is analyzed and processed, which turns it into a sound that the individual is able to recognize and understand. So some causes of APD. Doctors don't really know what causes this disorder, but they do have an idea of what it could be linked to, such as delays with the development of the area of the brain that processes sounds, neurological changes that are related to aging, neurological damage that can occur to degenerative diseases, which would be multiple sclerosis or meningitis. There could be problems during birth, which would be lack of oxygen to the brain, low birth weight, and jaundice. It could be linked to head injuries as well, genetics, or recurring ear infections. So, some symptoms of APD. It is difficult for the individuals to follow directions, so they will frequently ask you to repeat what it is that you said. They have trouble distinguishing between similar words and sounds. There will be a lack of focus, especially if they're in an environment that is very noisy and distracting to them. Their memory will be impaired when it comes to remembering things such as nursery rhymes or song lyrics, but however for us it is much easier. They will mix up the order of sounds in words or numbers in a sequence. They're unable to follow conversations and reply quickly. They have trouble expressing their thoughts and feelings clearly. And the symptoms generally start to appear around childhood. So how does having APD impact an individual's life? So it can affect how an individual speaks, their ability to read, write, and spell. They have trouble expressing themselves clearly because they confuse the sounds of different words. The individual with this disorder might end up dropping the ends of words, or they could mix up similar sounds. It can be hard for them, though, to talk with other people because they might not be able to process fast enough what others are saying to them, so they aren't able to find the right words to produce a quick response. They also have trouble remembering what it is that they hear. So there are 4 skills that are involved in auditory processing, and someone who has this disorder might have problems in any of these 4. So the first one is auditory discrimination. If an individual is weak in this skill, they might miss out on information or misunderstand what someone is saying to them. Number 2 is figure to ground discrimination. If someone is weak in this skill, then they would have trouble being able to focus on what one person is saying because of the busyness or the background noise that is behind them. 3 is auditory memory. If someone is weak in this skill, then they will have trouble remembering things that they hear, whether it be short term or long term. And number 4 is auditory sequencing. If someone is weak in this skill, then they will have trouble recalling the order of sounds. So there are various treatment options that an individual with APD can go through, but going without treatment can have a negative effect on a child's self-esteem and their social growth. This is due to them struggling with learning at the same rate as those around them, so like their classmate and their peers. APD cannot be treated with medication because it is a neurological problem, and there are devices that can be used to help amplify the sound for clarity, such as hearing aids. You can also treat APD with therapy. So compensatory strategy approaches best help those who have APD. These approaches help the individual take responsibility for listening successes as well as their failures. The therapist uses active listening as well as problem-solving techniques to help them. These strategies teach the students to ask for clarification or repetition of instructions. So just to touch back on compensatory strategies that was mentioned on the previous slide, these strategies help strengthen memory, attention, and problem-solving skills so that the individual can be able to manage their APD. What is taught in these treatments? So they teach the individual how to predict potential elements of conversation so that they will be prepared. They teach them how to use visual aids to help them organize their information. They incorporate memory techniques such as mnemonic devices, and they teach them active listening techniques as well. So another treatment option is speech therapy, which is very common. This therapy option can help improve the individual's reading and language comprehension. People who have auditory processing disorder have trouble with differentiating between sounds. They might mishear the words that someone is saying to them and think they're something completely different. So having them work with a therapist would help improve their ability to make and understand these sounds. Another treatment option is educational therapy. This option helps children develop strategies to compensate for skill deficits that they may have instead of just training them in the skills themselves. So children are able to learn how to manage their frustration, play to their strengths, and compensate for the areas where they tend to struggle most. So another way to treat APD is just changing up the lifestyle a little bit. Most difficulties that arise with having APD are based on surroundings and the individual's development itself. So there are different changes that can be made that will help and make a big difference in the individual's life. So for instance, you can eliminate distracting noises before speaking to them. So you could turn off the TV or music or anything that's going on that's unnecessary at the time. You can touch them on the arm or shoulder before speaking. This then allows them to have that time to shift their focus from what they were doing to the conversation they're about to have with you. And then you can ask them to repeat what you said to them to make sure that they understood it fully. And then remember to speak concisely to them. So another treatment option is auditory training. This can be done in person or with a therapist online. Some exercises that may be used are identifying the differences in sounds or sound patterns, determining where a sound is coming from, and having them focus on specific sounds while they are in the presence of background noise. So what exactly is all of these treatment options focusing on? They are helping the individual learn how to better process all the sounds that they hear, and they are teaching them how to use the different skills to help them compensate for their APD. And lastly, they are helping that individual make changes to his or her learning or work environment, and doing this change will help them be able to better manage their condition. So APD versus dyslexia. There are similarities between the two, which causes them to be looked at in the same way, but they are also very different. Dyslexia is a type of learning disorder where individuals have trouble with reading, so they might mix up letters. For instance, they might see the letter D as the letter B. Dyslexia is like APD in the way that people with dyslexia have trouble processing information. However, instead of affecting the part of the brain that processes sounds, which is APD, dyslexia affects the part of the brain that processes language. Like with APD, those who have dyslexia can have trouble with learning activities. And these learning activities mainly involve reading, writing, or spelling. So some things to remember from this presentation. What an individual with APD might have trouble with, and the factors that will play a role. So an individual with APD might have trouble with understanding speech, telling the difference between sounds, and determining where a sound is coming from. Some factors that might play a role are developmental issues, neurological damage, and genetics.